Hi, my name is Viviana Huarco. In this video, I am going to talk about the randomized trial of Posaconazole and Benznidazole for chronic Chagas disease. Definition: Chagas disease is a chronic parasitic infection caused by the protozoan Trypanosoma cruzi. This disease has two stages, acute phase and chronic phase. Depending on the phase you are in, it will be what determines the uses of treatment. Current therapeutic options are limited to benznidazole and nifurtimox. Cure rates of 65 to 80% have been documented when treatment is administered in the acute phase of the disease. Cure rate in the chronic phase range from 50 to 35%. In addition to the low efficacy of current drugs, another major drawback of this drug is their toxicity profiles, will lead to the definitive withdrawal of treatment in 50 to 30% of patients.
According to the Center for Disease Control and Prevention, triatamines, often called kissing bugs, are insects that suck blood and bite the faces of people while they're asleep. Some of these kissing bugs carry a parasite known as Trypanosoma cruzi. This is a parasite that could potentially cause Chagas disease. However, not all triatamine bugs carry the parasite. If the parasite is present, it will be in the insect's feces. The parasite is able to enter the skin of a person that is bitten if the insect's feces has accidentally been rubbed into the person's bite wound or into a mucous membrane such as the eyes or the mouth. Initial symptoms of Chagas disease include fever, body aches, headaches, and rashes. Anti-trypanosomal medication can be used to treat Chagas disease. In order to prevent the spread of the disease, the CDC recommends sealing gaps and cracks around windows and walls, as well as repairing any holes and tears on screen doors.
Application in medicine. Posaconazole is an antifungal agent of the triazole class that has been approved for the treatment of invasive fungal infection in humans. Its trypanocidal activity has been evaluated in both in vitro and in vivo models. In a murine model of chronic Chagas disease model, it was associated with cure rate of up to 60% in animals infected with strains of Trypanosoma cruzi. When tested in human trials with patients with chronic Chagas disease, posaconazole didn't show efficacy or relevant improvement compared of benznidazole, a higher failure rate than usual has detected with this drug, for which reason it had to be suspended in 40% of patients.
In the cell membrane is a lipid bilayer with proteins embedded in it. Ergosterol is the major sterol synthesized by 14-alpha demethylase enzyme that provides stability to the membrane. Glucan synthase complex, located in the cell membrane, is responsible for synthesis of beta-1,3 glucan chains. Elongation and cross-linking of the glucan chains with chitin imparts toughness to the cell wall. The azoles have broad-spectrum antifungal activity. They impair ergosterol synthesis by inhibiting the fungal cytochrome P450-mediated enzyme 14-alpha demethylase, inhibiting demethylation of lanesterol and accumulation of methylsterols. Lack of ergosterol leads to disruption of fungal cell membrane. Amphotericin has a high affinity for ergosterol in the cell membrane. several polyene molecules get inserted into the fungal cell membrane as aggregates after combining with ergosterol to form a micropore through which amino acids, potassium, and other water-soluble substances move out. Echinocandins inhibit the synthesis of beta-1,3-glucan, which is required for cross-linking between chitin and beta-1,3-glucan that gives toughness to the cell wall.
Pros and cons. Pros. Posaconazole has shown considerable activity in murine models of acute and chronic Chagas disease. The high-dose posaconazole regimen in our study was chosen to provide the highest exposure approved in humans. Cons. Posaconazole exposure may be greatly altered by fat intake. A lot of side effects were shown in the human trials. Posaconazole shown suppressive activity in human trials.
All of those patients in here, they have heart failure. That's why we have the rehab exercise, because the main benefits are in heart failure patients. He is Ricardo. He is a special patient because he's from La Sans. He used to live on the steak houses, and the kissing bug was hidden everywhere. So at night, when everybody was sleeping, the kissing bug will do their meals. So he believes that in his childhood he would be bitten. When he started here, he couldn't even be on the treadmill. He couldn't walk that much. So he is now able to walk and have a better quality of life because of that.
ISU applied in Ecuador. It is estimated that 2.24 to 3.8 million people in all, from a total population of around 60 million Ecuadorians, are exposed to the risk of Trypanosoma cruzi transmission. These estimates indicate that 120,000 and 200,000 people will be infected, with Chagas is cardiopathy as the dominant chronic form.
Seven to 8 million people across the world are infected with the parasite that causes Chagas disease, which kills over 12,000 people a year. The vast majority of patients are in Latin America, as Chagas disease is endemic in 21 South and Central American countries. As 60% of patients are symptom-free for several years, the available statistics are still far from reality. Chagas disease is one of the neglected tropical diseases which almost always afflicts the poorest on the planet. Bolivia, where the bug that transmits the parasite to humans originated, is one of the poorest countries in South America. With 15% of its population infected in 2010, and despite the program launched to combat the disease in 2003, it is still the worst affected country. Regional initiatives, particularly insect eradication, have halved the number of cases over the past 20 years, and divided by 10 the risk of contracting the disease. Transmission of the parasite by the vinchuca has been halted in Brazil, in Chile, in Central and West Bolivia, in Guatemala, Honduras, El Salvador, Nicaragua, and Belize. But Chagas disease continues to invade new territories. Benefiting from deforestation, it has now made an appearance in Amazonia, which up to now had been spared. In the Amazonian forest, the vinchuca is safe from insect eradication campaigns. The disease has also taken advantage of South American population migrations to spread to other lands. In 2010, more than 500,000 cases were recorded in the United States, and almost 100,000 in Europe, with roughly half of those in Spain. In South America, the cost of treatment is the primary obstacle to combating the disease. In Colombia alone, in 2008, the annual cost of treatment was estimated to be more than 230 million euros, and the cost of insecticide spraying to eradicate the bug was 4.5 million.
Conclusion. Posaconazole showed anti-trypanosomal activity in patients with chronic Chagas disease. However, there was a significantly higher percent of treatment failures compared to standard benznidazole treatment. Therefore, more studies will be necessary to authenticate or totally rule out its use.